And welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about allegations of fraud in California's drug Medi-Cal program. My guest this segment is Ted Lieu, a member of the State Senate from Torrance. Thanks very much for being with us.
Thank you.
So as we speak, you are like a half hour away from talking to the Joint Legislative Audit Committee at the Capitol, urging them to investigate what has become a huge scandal.
That's correct. I have requested an audit of California's drug Medi-Cal system, specifically the outpatient drug-free rehabilitation clinics. I'm very pleased the audit committee has approved the audit, and there will now be an audit of this system.
So what's been going on?
There's been allegations of massive fraud in the system. Examples of clinics, for example, seeing 30 patients and then billing the state for 179 patients. Examples of clinics billing for dead people, of clinics busing people in who are completely healthy and then charging the state for the counseling session.
And paying them, I understand.
And then also paying some people a small amount, a few dollars, to show up and then billing the state for a much higher fee. And then they do no services on these healthy patients.
You know, from time to time over the years, we hear stories about Medi-Cal fraud, but this seems to be almost systemic. And a lot of it's happening in Southern California, isn't it?
A lot of the examples came from Los Angeles County, but I fear that there were ineffective controls and lax supervision at all levels in all the counties as well as the state. We had both county and state regulators that essentially, in my opinion, failed to detect the fraud. And I wanted to know how long this has been going on, why it happened, and how we can change the laws and regulations in our systems to make sure it doesn't happen again.
And is that what the audit committee is going to be trying to
Yes,
decipher?
Exactly. And what's important is rehabilitation, to me, is extremely important to reducing prison overcrowding, reducing our recidivism rate. And I want to increase funding to these clinics, and I cannot, in good faith, do that. It's unfortunate.
And you're losing your supporters.
That's correct. This fraud undercuts public support for the program, and it siphons away money from legitimate clinics, and it wastes taxpayer dollars. So we need to root out the fraud before we can increase funding to these clinics.
It's my understanding that some of these clinics, after being found out, are still in business?
So what was very troubling is it appeared that in some of these instances, the regulators either wrote memos or figured out that there was likely fraud, and then nothing ever happened, and the clinic kept going and getting more patients. They would have these login sheets where, let's say you have 50 people sign up, and it all looked like it was in the same handwriting. And the regulator would write that up, and then nothing would ever happen. And so we want to know where was the supervision, where was the oversight.
And how long do you think it's going to take for this audit investigation to take place?
So the auditor testified in committee 2,900 hours. So I asked her, what does that mean? She said about 7 months. So that's fairly expeditious, and we look forward to getting that audit sometime early next year.
And then once that happens, do you need legislation, or can things be done administratively?
So part of the audit is to tell us what laws or regulations should be changed to make sure the fraud doesn't happen again. And if they recommend changes in the law, I will absolutely be bringing legislation to make those changes.
And you also want to put pressure to bear on those administrators and those offices or departments that have some oversight right now.
That's correct. And this program recently moved to the Department of Healthcare Services. To their credit, they've already suspended payments to over 108 clinics. They're actively investigating and doing top-down reviews. I look forward to seeing what the agency does as well.
All right. Well, Senator Ted Lieu, thank you very much for coming by and talking about this important issue, and we're going to certainly follow the progress in the months moving forward.
Thank you.
And thanks to our viewers also for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on My Government On Demand, also on YouTube. I'm Steve Swatt. Have a great day.